Celiac disease is extremely common in our society. Close to maybe 1 to 150 to 200 individuals, or maybe more, who may well be symptom-free, asymptomatic, have celiac disease. There's a spectrum as to how celiac disease presents. Most patients don't have symptoms. Some will present with weight loss, diarrhea, sensation of fullness in stomach, don't want to eat. That used to be the common presentation when we knew little about how to evaluate a patient with celiac disease. The technology that is available to us now allows us to, in a non-invasive fashion, evaluate, diagnose a potential patient with celiac disease. Now, it turns out that it may well be that more patients do not have what we call wheat gluten intolerance. So celiac is really an intolerance to food products that have gluten, such as wheat, rye, barley, maybe oats. And these foods that are taken into our system, and we eat them every day, pasta, great breads, damage the lining of the small intestine. That's where digestion takes place. By doing that, symptoms develop. Now, as I said before, the majority of patients may not even have symptoms. So how do we proceed to evaluate someone that may carry the propensity to already have celiac disease? If they have symptoms, it's very easy. If you have a family history of celiac disease with several members, you should test the other members because there is an increased incidence of celiac in relatives of patients with celiac disease as well. So there's a blood test. There are several blood tests, but the more specific ones that are available to any physician, done by any lab in the world, is the serum transglutaminase level. Others call it the anti-endomysial antibody. It's a blood test. You take a small sample of blood, you test it in the laboratory. If you get a test that is positive with a reading above a certain number, then is something that the physician has to pursue. And it doesn't have to be a specialist like myself, a gastroenterologist. It does that. Any physician can do that. Once that blood test is done, if it's positive, has a degree of positivity of so-called specificity of 98% or greater. There are other more sophisticated testings that gastroenterologists do, but for the most part, there's no need. Now, it's important to confirm the diagnosis because, as I said, it turns out that celiac disease is common, but less common than gluten intolerance. That is, there are patients who eat wheat products and feel lousy. They feel bloated. They develop bloating. They have abdominal pain. They may or may not have diarrhea. Yet, when you test them with all the specific testing, including biopsies of the intestine called duodenal biopsy, they do not as yet or have not developed true celiac disease. That means that the biopsies are normal. So that's important to differentiate from true celiac because celiac over the long term has inherent risks of conditions that can be detrimental to the patient. They can affect the life of a patient. There are certain tumors that occur in patients who have long-standing celiac disease, such as lymphomas, tumors that affect the small intestine, or even cancer of the small intestine. Patients with celiac disease can be very malnourished, could have deficiencies of many vitamins, such as B12, vitamin D, iron. Some of the common ways for patients to present to the physician, even though he or she may be symptom-free, is to have a low iron in their blood. We call it an iron deficiency syndrome. It's caused by many things, but one of them is celiac disease. Some patients also may have on a routine blood test some abnormalities of liver blood tests. We call them transaminases. And that could be also caused by celiac disease and not hepatitis or liver cancer or other serious illnesses affecting the liver. So it's important for the physician to be aware of the other ways how celiac disease presents. There are other presentations that are more unusual, very rare types of neurological changes, severe headaches sometimes, but these are not the common presentation. The common is to be symptom-free or have some GI symptoms, as I mentioned earlier, or have a low serum iron deficiency. When that happens, if the blood test is positive, the diagnosis must be confirmed because the diet is a strict diet. It's a tough diet to follow, but it can be followed. And today in our society, there are many ways to live with a gluten-free diet. And the final way to confirm the diagnosis is to do a special test called endoscopy with a little light. The patient swallows the tiny tube. The physician goes down to the area of concern called the target area, and that's called the duodenum. You take samples, they're seen on the microscope, and you find the changes that are compatible with celiac disease.